information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing.
Hey everybody, Dr. Tom Roselle here. Welcome to Ageless Health live stream. And we got a program today that kind of puts all of the finishing touches together of what we've been talking about over the last several weeks. And that's going to segue into April the 16th at the Roselle Center for Healing in Fairfax, Virginia. So those of you in the area, join us. Please register ahead of time. You can do it a couple of different ways. Go online at rosellecare.com. or simply call the office 703-698-7117, and we'll be glad to see you. Dr. Stephanie Pina and I will be doing a whole evening on why it hurts, really. I mean, but what's pain all about, if you will. We're going to talk about 5 types of pain patterns that are chronic and they hurt and they cause problems today that can be fully and totally resolved. And you need to know that. You don't have to deal with pain. Opioids and all the other narcotics and pain medications are not the way to go because they have side effects and addictive patterns. And ultimately, you can destroy your life with them. And I don't want any of you to do that. And some of us just go numb, we'll drink or we'll use social drugs or things like that just to kind of keep the edge off on an ongoing basis. I don't know about you, but for, this boy, the body's such an amazing mechanism, and we have to support it, not drug it. We have to grow it and enhance it, not depress it and deplete it. So let's get into that a little bit today. The type of pain patterns, if you will, we're going to deal with 5 of them. There's actually a lot more than that, but these are problems that can, easily be, once if they're identified, you have to deal with the cause of patterns. And we're talking about functional conditions. And what do I mean by a functional condition? Something that is present in an abnormal, aberrant way because of its neuromechanical disrelationships, where they should be talking to each other, they should be working together ideally, but now they're not communicating the way they're supposed to. So as we go forward, I want you to think about the body this way. Brain, spinal cord, right? So we have this noggin called our computer. Underneath that, you have a coaxial cable called the spinal cord. Off of that, you have 31 pairs of nerves. Now, those nerves do something interesting. They divide. One branch goes outside and causes the muscles to work, allows you to move your arms like this, your hands like this, and move your head around and so forth. And another branch goes inside and hooks up to the organ system. So you have an ongoing conversation, if you will, neurochemically, neurologically, between the inside of the body and the outside of the body. So just as a general concept, I want you to think about that. And then you have bones that protect that mechanism. They're called vertebrae. It's called your 22 bones that make up your head. It's called your pelvis that encases and allows all that lower portion of your body to be protected and restore function and motion. So let's get into it just a little bit relative to pain types and why it's so important that you understand them, but really understand that they can be fixed if you're willing to become a partner in your own health. And that's the key. You have to participate. It's not one of these things is do it yourself, situation by yourself. It's not your doc doing it to you. It's forming a partnership, a relationship. And remember the term, and this is the other piece I want you to remember, the term physician, regardless of who's wearing it, simply means teacher. It's their job to teach you how to enhance your God-given normal physiological expression and to be able to enhance it and to be able to deal with it. Not suppress it, not drug it, not dim it down, but to enhance the natural capacity of your body. So let's get into it just a little bit. We're going to talk about 5 interesting situations that generally can be resolved, can be fixed, can be dealt with if you know what to do with it. If you can take the time to understand what really is going on. So, the first one that we're going to really talk about is something very common and it's simply neck pain. What happens if your neck hurts and it's difficult to move, and it gives you sharp shooting pain, perhaps up in the top of your head, or you have pain that comes around and through here. Sometimes it feels like it's coming down the side of your face, and you're going to docs, right? And you say, oh my God, what can I do about that neck pain that I have? And where's it coming from? Well, there's multiple causes of neck pain, and you have to find it very quickly. It can be a muscle that is just over tight strain because you've been doing the same thing repetitively over and over and over and over again. Or it can be a slipped or bulging disc in between the bones of your neck, the vertebrae, remember? And it doesn't have to be a huge leakage of that disc space. It can be just a bulging of that disc space. Or it can be a disrelationship of the gliding points of the bones. So what happens, it sets up a noxious receptor pattern, meaning receptor means that the signaling mechanism, if you will, that targets and goes in different areas of your body. So that neck pain is very common on an ongoing basis. It can be from an old injury. It could have been a little bit of a fender bender that years ago you didn't think too much about. Car hit you from behind, knocked you back like this, and then your head goes forward. That's the whipping action, right? So when that happens, the tissue gets overstretched. Now, in any of these things, I'm going to mention something right now that I want you to hold on to, is that the body remembers injury that has not been fully resolved or recovered. And sometimes we put up with. So what do I mean by that? So let's say that you get hurt, and all of a sudden you notice that if you go way too far in rotation, that hurts you. It may send a little pain down your spine or give you a headache real quickly. So, but if you only do this, that much, it no longer is a problem. So what do they do? The patient, you only go this far because you don't want to hurt yourself. So now you adapt, and somebody asks you, do you have any problems? No, it's not a problem. The question becomes, is that what are you doing to modify, and is that normal? So within the context of neck pain, you got to find out, what the deal is, and if it is a structural problem, a structural misalignment in my world. And by the way, that's what it usually is. In my world, that's called a spinal subluxation, or a vertebrae, a bone that's out of position. So that headache, the tenderness in your neck, the tingling down your arms, sometimes the burning sensation, all those things have to do with things that happen to the neck from a muscle strain, repetitive overuse situations, not enough muscle integrity, discs that begin to degenerate and so forth, and whiplash, ultimately leading progressively over a period of time to very advanced spinal degeneration, which we call what? Osteoporosis and osteoarthritis, because you're going to lose calcium. That's why I put the osteoporosis in there, but arthritic conditions. Now, the thing with it is that tingling, that burning and so forth, once it's there, don't ignore it. You have to begin to take the steps to do something about it. Otherwise, it will progress and it'll get worse and worse over a period of time. Generally, when you're talking about the approach to fix it, in our world, we're going to be using manual manipulation. We're going to be using cold laser therapies. We're going to be using pulsar frequencies. We're going to be using ultrasound rehabilitation, but we're going to use them together, even acupuncture, and we'll do them together. If you do what's necessary, you restore full range of motion, you restore the capacity of the muscle to do what it's supposed to be able to do, the pain goes away. Now, the last piece of that we have to take responsibility for is, what are we feeding our body that may be causing inflammation? Remember, inflammation is acid, and what? And swelling. So we have to approach it from a multi-discipline approach. So I'm promising you that these things can be resolved. One, if they're caught immediately, they're treated fully, completely, and not just to, oh, it feels better, I'm done, or take 2 aspirin and call me in the morning type of situation. That's not how it works. You have to be willing to do what it takes to resolve the condition fully. But with manual manipulation, with the application of acupuncture, with the right nutritional protocols, with rehabilitation and so forth, and it's taken to a point where it goes far enough to allow the body to restore and heal and regrow tissue, that is something that can be resolved. But if it's not done that way, now you have a problem that's going to continue. Let's go to the one of the most common causes. 80% of adults in the good old United States, and actually probably every place else, has something called back pain. And that back pain is something that stops us. It's the number one cause of loss of productivity. It's the number one cause of lack of income. Because you can't work if your back's hurting you, right? And you're on all kinds of drugs, and those drugs are pretty significant, and they dumb you down, and life is not good. And again, we can go to the place of these things being partial patterns. What happens if you got too much of that loving, those love handles around your waist? And I mean, that's somebody that's got a little bit of something. A lot of you are just crazy about, you got to have no fat on your body. Well, that's not going to happen either. But the point of it is what happens if you have this overextended, paid-for belly, and it's putting a tremendous amount of pressure on that low back. And all you have to do at that point is sneeze. You could be constipated, and you have to push too hard, and all of a sudden you're going to pop something. You're going to have that disc bulge. So you can have nerves that are trapped. You can have these gliding points, we call the facets, are going to be jammed up. You're going to have that degenerative spinal stenosis that's going to occur over time. If you don't use it, you lose it. That's osteoporosis as well. And so when we're looking at that, again, we're dealing with a structural problem, low back pain. At some point, 80% of all adults will experience back pain. And when the pain goes away, if you ask them, it's because they're taking drugs or they've given up what they like to do. It's like I'll ask a guy, I said, on a 0 to 10 basis, what's your pain like? 0 is non-existent, 10 is over the top. And they'll simply say, well, as long as I don't lift my kid, it's about a 4 or 3 or 4. I said, what? As long as you don't lift your child, it's a 3 or 4? Yeah, and that's okay with you? You don't want to play with your child? You don't want to go out and have kick the ball around and do things like that? And you're willing to give that up? Is that all right? So obviously it's not. And, you have to understand that these things are resolvable unless you put them off so long. And now you've acquiesced to the drugs, which are going to cause further deterioration and breakdown and so forth. So, and then you have these flare-ups, right? 80%, as I said, of adults have back pain, and 50% of people who are working in America have at least 1 to 2 flare-ups every less than a year's time. That's not okay, my friends, particularly when it's something that can be resolved. And a lot of us just put up with, or we're told, take this medication for that. It's not about numbing the pain. It's about restoring normal function. So the question is, are you willing? Are you willing to resolve this? Well, on the 16th, we're going to get it done. We're going to show you how to fix these things. We're going to show you how to resolve a lot of these common pain situations. How about headaches? When we talk about headaches, it's like 8 and 10. We're going back to 80%. 8 and 10 United States adults have at least an occasional tight, hard headache that can last up to several days. And it's not okay, right? The symptoms strike on an ongoing basis. Migraines and pressure headaches and pressure behind the eyes, feels like somebody's got a knife in your eye and so forth. So what we're talking about is 1.2 million visits to the emergency rooms on an annual basis for acute migraine headaches. Now, let me tell you a personal story, which a lot of you already know if you've listened to me. The reason I do what I do, the reason I'm a chiropractor today, and I have all the other add-ons in acupuncture and nutrition and so forth, is because of my wife. When I got married years ago, Sue had migraines from the time she was like 5, 6 years old. Now we're in our I think we're about 24, 25 years old when we got married. And the medical fix and the drug she was on and the headaches would knock out at least 1 day a week was to fuse her neck from the second bone of her neck, second cervical vertebrae, down to the 7th, because they were convinced that it was an irritation in the cord. She had a reversal, a backward curvature in her neck. And that was her answer. And I said, I don't think so. So we put her into a facility that does straight structural manual adjusting of the misaligned vertebrae, of the subluxation patterns. In 30 days, her migraines were gone. And it took her about 18 months to restore the curve, just like dental bracing, right? You got to bring it back into the normal pattern. But that's why I continue to do what I do today. So when we're dealing with migraines, there's the number of people suffering with migraines across the globe, across the world. We're talking about a billion people. A billion people. Think about that. There's reasons that they occur both biochemically and structurally. And if you can identify the reason, it may be an old concussion, it could be people eating stuff that they shouldn't be eating, it could be other things that are causing stress patterns that cause the cranial plates, the bones, the 22 of your head to lock down. Once you identify the problem, it can be resolved. It's not about going to the cabinet and getting Excedrin or getting Tylenol or a combination of those things or getting an opioid and try to numb it down, or going to bed and closing the, so, and we know there's many different types of migraines, but they still have to be understood. And if you approach them properly with manual adjustments, some acupuncture, nutritional protocols, you can resolve them, not just control them, but you have to be the partner that is willing to bring you back. See, your body wasn't made, if you will, to suffer these things on an ongoing basis. Your body was made to work beautifully, ongoingly, and to enjoy life. But unfortunately, we get into a loop. Oh, I hurt, take this. Oh, it's still there again. I got to take something a little stronger. It's not going away. Now we're going to do an injection. Oh, well, maybe we have to look at surgery. That's not the way your body was designed. If you were willing to resolve things, then you can begin to fix the problem, but you have to understand it and then understand how to enhance the body's ability to restore function on a structural basis, a biochemical basis, and an emotional platform. Let's take the fourth piece of the puzzle. We've all heard of arthritis. Oh my God, it's arthritis. There's nothing I can do about it. Well, if you look in Dorland's Medical Dictionary and you look up arthritis, there are many, many different forms of arthritis. You have rheumatoid arthritis, you have degenerative arthritis, you have gouty arthritis, you have psoriatic arthritis. I mean, it goes on and on and on and on. Which one's yours? Which one's your favorite situation? If you have these joint spaces that are painful and you just can't open them up, why? What's the reason for it? So you have to understand the problem. Most arthritic conditions come about because of injury. An injury can be traumatic, a blow, a trauma, car accident, something like that. It can be postural. You're in a lousy position repetitively. You're not in shape. Your mechanics of your body has been altered in some way. And on top of that, you eat like garbage. I just came back from Italy. I taught in Naples, Italy for 3 days. And I sat there and I mused over the fact that the food was so good. And these 36 osteopathic physicians that I was lecturing to, were sitting there and they're asking me, am I enjoying the food? And is there anything they can get? I said, enjoying it. I said, this is the best food that I've had. And they start laughing. They said, yeah, food in the United States is not good. And I said, can't argue with them. Absolutely. We're being polluted. So you have to be very careful with what you put in your system. You have to buy organic. You have to buy foods that are not genetically modified. And you have to drink enough fresh water, not in plastic containers, to make sure that you're not accumulating toxins, the plastics, which are estrogenic as well. And so, but we have to educate ourselves. We can't listen to the talking heads. Remember what we all went through with COVID. We listened to all the BS out there. It was all garbage. And we walked down that ugly path. And it cost us, many of us, it cost us our lives. But when you have an arthritic condition and you have cartilage that's being broken down, joint spaces that don't work, you have to understand why they might be there. They can be everything from an infectious type of condition that's causing it. We know that when the microbiome of the intestinal tract is not balanced properly, that can be an issue. So we have to look at the microbiome. We have to look at the inflammatory reactions and why that cascade is continuing. We've heard the term and branded in our brain called interleukin 6. So IL-6 is one that it's there for a reason, but unfortunately, if interleukin 1 and 10 aren't working, then that inflammatory response becomes acidic, it becomes degenerative. And I know these are a lot of words, but we're going to get into that on the 16th as well. I'm going to answer those questions. So join me. I promise you, I'm going to give you some really specific why is that and how do you resolve the problem. But arthritic conditions, very advanced conditions in the United States of good old America, affects over 55 to 56 million people. And they have some type of swollen joint. And, the doc says, oh my God, I got a rheumatoid condition. Well, you might and you might not. There's ways of identifying it specifically, not just by doing an ANA test and said, oh, well, your anti-nuclear antibody level's up, so, you have rheumatoid. Well, no, there's a lot of other things that can cause that to occur. So you have to make sure you understand what they are and why. Osteoarthritis occurs when any cartilage in your body, whether it's a knee or a hip or your fingers or your neck or your shoulders, any of the movable joints now become degenerative. They start breaking down. The question becomes why? Just throwing an arthritic cream or taking an herb or something. Are you willing to change your behavior? What does that mean? Are you willing to really step up to the plate and say, yeah, I'm probably not eating the way I'm supposed to? And yes, how many of you drink sodas, Coca-Cola? Let's put the name out there, right? You want to see how bad it is? We can do a couple things. Get a saucepan and put a quart of Coca-Cola in it, then slowly bring it to a boil and keep boiling it. So what you're going to see is the volume will expand for a second and then it contracts. And then if you keep boiling it, there's this ugly stuff that forms that is thick and everything else is gone. And it'll take the metal off the pot and it destroys and it clogs up the arterial beds in your body and so forth. It allows your calcium to come out because it's highly acidic. Try the experiment. We're going to school systems and I have the kids get a beaker, right? And we fill up the beaker, something, about that size. And so we fill it all the way up with Coke. And we put a piece of meat in one beaker, then we get a second beaker and we put a little bit of a bone in it. And then we get a third beaker and we put a little nail in it, like a roofing nail. And we put cheesecloths over the top and we have them talk about what the components of the phosphoric acid, which is acid, and the other pieces that are in, and we have them predict what could happen over 3 days. What do you think could happen? Well, let me tell you what happens. The first beaker with the meat in it, you come back, it's gone. It's not there, it's dissolved. Second beaker, that bone, pretty much gone. You might have a few flecks of bone floating on top. The third beaker, that nail, it's pieces, it's broken down. And if it can do that to those substances, what's it doing to your body when you're drinking that stuff on an ongoing basis? And it's not just true for Coca-Cola. It's true for Pepsi's. It's true for Mountain Dew. It's true for any of those things that have the phosphoric piece. But Coke is the worst. It's the number one culprit. So if that's the case, got to do something about it. It's time to stop. It's time to make a difference. And let's get into something called neurological degenerative damage, right? So nerve damage can result because of what? Diabetes. That's blood sugar transport problems. And everybody says, well, I'm predisposed. My father had it. My mother had it. Look, we used to call it adult onset diabetes. Okay. And that's because we see people as they got stupider over the years and started adding tons of garbage to their dietary patterns, that these things started showing up. Blood sugars got too high and so forth. Now we just say it's type 2 diabetes. That means that we're seeing kids, because of the dietary patterns, because of their lack of activity, because of they're sitting there with their iPads and their phones. They never go outside, but it started years ago. So when we're looking at nerve damage, and we know that it affects somewhere around 25 million Americans, that's a lot of people. And there's actually about 100 different types of nerve damage that you can have. So everything from diabetes to what's called spinal stenosis. That's where the hole that the nerve comes out in your spine gets narrowed down and it crushes the nerve. But there's many other different. So we talk about peripheral nerve damage, we can talk central nerve damage, we can talk about things like that. So when you have pain or you have tingling, you have weakness, sometimes even lightheadedness, and it can go to paralysis where you can't do what you normally do. You can't walk. Even your bladder, that urinary frequency, that can come from an arthritic degenerative condition, stenotic stenosis, narrowing in your spine. And you're running to the doc and taking all kinds of medications and trying to open it up. It can cause dry mouth. It can cause what? It can cause your eyes to be dry and so forth. So we want to find out what the problem is and how to affect it specifically. Chiropractic care is the number one area, in conjunction with lasers and acupuncture and nutrition, that will resolve these things, but it needs you as the partner. You have to step up to the plate. You have to be willing to make some changes. You have to be willing to go for a walk every day and just do some gentle stretching, get some motion in your body, and so forth and so on. So when you understand that there's reasons that all of these things occur, and when you know that they occur for a reason, you can reverse them. You can change the pattern. So join me coming up very quickly this coming Wednesday evening, the 16th. And I promise you, I'm going to show you, I'm going to demonstrate to you how this works. So schedule right now, go to the computer, go to either drtomroselle.com, go to rosellecare.com, or call the office at 703-698-7117. And we're going to have some fun. I'm going to show you how this all comes together, and we're really going to put all the pieces in place for you. So I promise you, stop hurting. If you're willing to resolve your silly life habits, the things that you've been doing, the things that you've been putting up with, the drugs that you've been taking, and consider different options, this is how we're going to do it. I'm going to show you things that will help along the way. There's good homeopathics that will begin to dumb the fire down a little bit, begin to restore function. But it's up to you. You have to be the one that says, okay, I'm in. I got to change something because I can't live like this anymore. Enough's enough. Join me the 16th at the Roselle Center for Healing in Fairfax, and I'm going to show you how to put the fire out. Remember, the reason I'm here every week, and hopefully more often than that, is simply because, one, you deserve all the information the right way, and secondly, I love you all. See you next week. Take care. Bye.